and we are embracing the new norm together with pharmacy. This is Caring Pharmacy, as well as Betadine. Today, we're going to have a very special session. Before that, let me introduce myself. My name is Jen, and I'm a singer-songwriter. I'm a host, as well as a content creator. But you know what I'm not? I'm not a doctor, okay? See all these products here? I'm sure you've seen it on over the counter, everything. You can see all the products there, but some of you might or might not know how to use it just like me. So if you have any questions at all for this session, please do let us know in the comment section down there. And so we can help you ask doctor, okay? We have a real doctor here, okay? I am not playing any character or whatever, okay? Here, we are getting serious. We are embracing the new norm together. So before we get anything started, I want to say hi to all of you. We have Chi Chu Yon. Hello! Comment where you're from, guys. Let us know. Are you from Penang, Malacca, Johor? Mana-mana lah, my hometown is Negeri Sembilan. So if you're from Negeri Sembilan, let me know as well. Share some love. I always say this, okay? Spread love, spread joy, not germs. That's what we want here, okay? So also scan the heart shape, share it with your friends, because today we're going to learn together. We have some fun, and at the same time, we learn about how to use these products in front of us to up our hygiene game, okay? Yes, I know that's not a scientific word, upping your hygiene game, what? But you know what? I am just like you. You and I, we are the same. We got lots and lots of questions. We are nervous about this whole situation, this whole COVID-19 situation. And now that, you know, businesses are slowly opening and we are venturing out, we want to up again our hygiene game. So, you know what? I prepared a lot of questions, you see. I got a lot of questions that I want to ask Doctor already. So if the questions I ask, you feel like there are more questions you want to ask as well, make sure you comment, okay? So I see Ng Mei Lee. Hi, Jen, KL, from KL. Hello. John Liddell, he's also watching. Who else we have here? Yanni. Hi, Yanni. All right, we also have studio audience. Make some noise, studio audience. Thank you. We are social distancing, guys. We have no studio audience. I have a clap track here, okay? Thank you, studio audience. So imagine you guys are in front of me, okay? So again, if you have any questions at all, make sure you comment, type in the comment section, and also stay tuned to the end of this entire session. It's going to be about 30-40 minutes, and we are going to be giving away this gift set. So if you want to know how you can bring home this care set, make sure you stay tuned until the end. Without further ado, I think it's time for us to introduce our special guest, hailing all the way from Singapore. Our special guest is a doctor, of course. He's the head of medical affairs for Southeast Asia at Mundi Pharma, a leading pharmaceutical company globally. He's Dr. Murtaza Qasuri, okay? And you know what? Qasuri, sorry, he's going to correct me. I'm going to have so much problem with this. Dr. M. I'm going to call him Dr. M so I don't make mistakes, okay? So, shall we invite him, everybody? Once, when Dr. M comes in, I want you to put your hands together. Dr. M! Woo!
Hi, Jen. Thank you for having me.
Hello, thank you so much for joining us. How are you doing today?
Very well, fine. Thank you. How are you?
I'm good. I'm actually really excited. I was actually very nervous because when they said that we're going to talk to a real doctor, I was like, should I speak better English? Should I enunciate? But they said, you know, be myself. So I'm going to be myself. I hope you don't mind. I'm a little bit weird.
Please be yourself. You're doing fine.
Awesome. Thank you so much for joining us. And I know that today we're going to be walking through how to use these products. So before we actually touch on that, I want to announce and remind you guys there's going to be a giveaway. The question is going to be released in the middle of this live stream. So what we're going to be giving away, this Betadine a care set right here worth 150 ringgit each set. We're going to be giving away five. So you could be a lucky winner, okay? So the question will be released later and you're going to have to answer it. And we're going to include the hashtag, everything. I will talk about that later. So don't worry. Right now, we want to get straight into it. We want to have a chat with Doctor and see how it goes. So Dr. M, the first question is, how has COVID-19 impacted your work, your roles, your responsibilities as the head of medical affairs?
So Jen, that's a tough question, but I'll try my best to summarize it. Everybody has to understand what medical affairs does. Medical affairs is basically a very healthcare provider-centric function. So a lot of this function depends on constant communications with the healthcare provider, whether it is to do research or to initiate scientific communications, medical education. And all this we do to make sure that the right drug reaches to the right patient and ensuring that the patient safety is not compromised. So initially, when COVID-19, led us to all the lockdowns, it was disruptive in many ways. We had reduced communications because the healthcare providers were, overall burdened with taking care of the patients and also protecting themselves. So they were, avoiding contact. But over time, as things started to settle down, while the lockdowns remained, we used the interactive tools, to set up meetings, virtual meetings, webinars, use phones to re-engage with our healthcare providers. And now I would say that, our communication is even much better and much more frequent than it was actually in the pre-COVID days. So I would say that it was a cultural shift, which actually showed us new opportunities. So disruptive, yet also full of opportunities.
That is so cool because I can relate to that. Although, I am a content creator, for me, almost every single day I would have shoots here and there. This was before the lockdown. And then when the lockdown was announced, I had to readjust. I was stuck at home and I felt like, what can I do? Right? There's nothing to do. And then slowly I kind of got used to it and I actually enjoyed working from home. But then now that we're slow, my office just opened last week and we're all like getting back to that daily grind. I noticed that I had to readjust over and over again. So it can get quite overwhelming. And those of you watching right now, I imagine you can relate to our stories as well, because it really is a real total shift. But at the same time, I think we are presented with the things that, we never really thought about. For example, like for me, I didn't think that I would be so obsessed with hygiene. That was a change, but it's a good thing. That's a good change, right? I noticed that when I'm out these days, correct me if I'm wrong, guys. You're watching right now in public. You're watching right now in public. For me, when I hear someone sneeze or cough, this is my reaction. I don't mean to be judging, but this is my instant reaction. Excuse me. I get really uncomfortable, so I'm always trying to find ways to prevent the spread or even to protect myself. So, what other ways can we do to prevent that? And apart from on top of the standard SOPs like wearing a mask, washing hands, or maintaining social distancing.
Okay, so yes, I'd like to reiterate that physical distancing, PPEs, masks are all mandated by the government, by healthcare bodies. But while these are important steps, I would like to mention that hand washing along with oral hygiene are also very important steps. Besides, more importantly, I think everything begins with a good immune system. So if you're eating well and exercising regularly, you definitely got to have a very good immune system. This can keep you in shape, boost your immunity as well. And those who have better immune systems would actually fare better with the pandemic than those who don't. The other objective is to maintain good oral hygiene because the virus actually resides in your nose and your throat before it goes into the lungs and causes a severe infection there. So if we can, ensure that we mouthwash or use goggles that are effective in killing the bacteria, and maybe if there is any evidence that they killed the SARS-CoV-2 virus, then they would be very good to use and prevent that virus from getting into the lungs. But more importantly, those who have diabetes and hypertension, it is very important to keep them controlled. And last but not the least, I think this disease or this infection has the elderly at its gravest risk. So if we are helping them, that would be the most important thing that we can do for our community.
I think that's a really, really good point. And, you mentioned earlier something about oral hygiene. And right here, I am straight away, my eyes darted towards this, the sore throat spray. I'm looking at this because a doctor actually recommended me to use this before when I wasn't feeling well. So first and foremost, what maybe you can introduce to us, what is the use of this sore throat spray, Betadine sore throat spray?
So Betadine is a brand name, and it contains a product called povidone iodine. And this povidone iodine is essentially an antiseptic that has the ability to kill viruses, bacteria, fungi, and even protozoans. So it's it's broad spectrum in its ability to kill germs. And since we are surrounded by germs all the time, it would be good to, like use throat sprays anytime you're feeling weary, because, like the first signs of falling sick are, like conditions like fatigue and malaise, etc.,
Yeah.
etc. And if you can, feel a bit of a pinch in your throat, maybe throat spray would be a good thing to use. So povidone iodine actually kills viruses that reside in the throat and may cause cold or pharyngitis, or a condition called as the inflammation of the throat. It may also kill bacteria that can cause sore throat. So basically, it's a very good antiseptic agent for preventing sore throats, and also can also prevent colds if it can kill organisms that cause sore. Yeah.
Right. So here I'm reading straight up. It says 85% of sore throats are caused by viruses. So
Exactly.
this, as you mentioned, is an antiseptic for the throat, correct?
Yeah.
So I'm just going to demonstrate it, and I hope you guys are watching right now. I don't know if the camera can come close. So this basically is like a nozzle. It has a little spray right here. If you've not used it before, I'm just going to try it right now and try to be your eyes, ears, and taste buds. Okay. So do you do it here, or do you just put it farther away?
No, you need to bring it closer to your mouth.
Closer
Get
like
it
that?
in. Yeah, just between the, yeah, perfect. Go in a little
All
more.
right. Okay. Here we
Go,
go.
go, go like you would use a breath freshener.
Oh, okay. Yep.
Yeah,
Just
correct.
one squirt is enough, right?
You can do 2 squishes are good, and keep your mouth open. Slightly take your tongue out so that it creates a way for the spray to go into the deep side of your throat.
Okay, so I do feel this menthol sensation.
Yes.
It doesn't feel like it doesn't feel very gross. It's not something that I look forward to. I'm gonna be real with you. It's not like, yeah, this tastes amazing. But what I do feel like is it's really nice after there's this menthol feeling after, which is really nice. And what's good is that it's antiseptic. So this one, would you recommend for those who have already have like the symptoms of like early signs of getting sick, or just for anybody? Anybody should already have this.
So it would be good to keep it with you when you are impacted by pandemics, for example, times such as now. While this is not the first pandemic that we've experienced. We've experienced SARS in 2003. We experienced another pandemic like MERS in 2015, which frightened the world. But I guess nothing has been as precedented as this one. And it's really for these occasions that one should have a product like this to protect them, because all these viruses eventually start with a throat infection and then go in and infect your lungs. So it would be a good thing to keep with you.
Perfect. So again, today we're talking about the new norm, talking about how to up our hygiene game. So this earlier we just tried out the sore throat spray, and I am seeing that we have a question right here. I'm gonna go close to my computer so I can read it correctly. Okay. So here, someone said, just wondering, how can you tell the cough medicine or spray has gone bad or been compromised, even if the product has not expired? Oh, that's a really, really good question from Lucy Tan. Doctor, what are your comments on this?
Okay, that's a very good question. So if you feel that the taste is odd, it does not taste a bit slightly sweet, but also mentholish, then don't use it. Just report to the quality department or the pharmacy, and they can come back to us. The other thing is that you could also test it on maybe a tissue paper. If the color is like golden brown, then that's the right color. But if it's like pinkish or yellowish or brownish, or too dark, then there could be something wrong. So the best thing is that before you do it in your mouth, spray it in your mouth, do it on a tissue paper to see whether the colors are corresponding to the ones that we advise. Yeah.
So what the doctor just said, discoloration or any like weird smell that is not this product, like it's not the usual scent or the taste, then that is a product that has gone bad already. So that's a really, really good question. Thank you so much, Lucy. So earlier we've mentioned about, respiratory hygiene. We want to move on to this next product right here. And this is another one that I'm sure a lot of you have seen it before. This is the Betadine Goggle and a Mouthwash right here. So this one, let's just talk about the basics first. Doctor, what does this do?
So this is the cold defense nasal spray. Is this the? No, sorry. This is the mouthwash.
Yes. Oh, yeah, exactly. It is the
All right.
mouthwash.
So the mouthwash contains povidone iodine at a
Mm-hmm.
concentration of about 1%, which has demonstrated with a lot of scientific evidence to have killed many bacteria that are found in the community, including some very dangerous bugs that cause severe respiratory infections, viruses. Of late, we have evidence that they also kill SARS-CoV-2, which has recently been published in a very reputable journal called British Dental Journal,
Mm-hmm.
which is part of the Nature group, and this evidence can be accessed from there. In addition to that, so this is very relevant for these times because it has demonstrated to kill the virus that causes COVID-19. And number two is that it kills all these bugs as fast as 15 to 30 seconds. So when you're gargling, let's say, when you're gargling, you wouldn't tend to, gargle for more than 15 to 20 seconds, right? So this is just the right time for the product to actually kill the bug. And it's quite tuned with human ability to gargle for that long also. But let's say if I asked you to gargle for, let's say, 1 minute or 2 minutes constantly, it would be difficult.
Yeah.
So the timing with which it kills the virus is also, tuned to our ability to adjust to the gargling regimen. So
Mm.
this is evidence-based, and I think that's why this goggle is a very important ingredient or agent right now in our defense versus protecting ourselves from COVID-19.
So this gargle and mouthwash, I remember using it when I had like a sore throat. So I used it because it was recommended to me, and I didn't really had the chance to like speak to a real doctor. So I'm just gonna ask you straight out, if I have a sore throat and I use this mouthwash, will it help kill the bacteria and treat my sore throat faster? And if so, how frequent should I use it?
See, your sore throat or your infections are entirely dependent on what is the state of your immune system. So, if your immune system is good at baseline, and God forbid you don't suffer with illnesses that are grave, like where you could, where somebody has cancer and is getting chemotherapy, then they have altered immune systems, and
Mm.
then the bugs that come and infect the throat can also be many, many, right? But for large majority of patients, we have tested this product in cancer patients who develop throat infections or mouth infections post chemotherapy. We have also demonstrated the efficacy of this product in general population that get afflicted by common bugs. And it has demonstrated that it kills a large variety of organisms, viruses, bacteria that could cause the infection. So the evidence, and it's now being recommended by many medical associations and bodies, whether it's dentists or ENT specialists, they're all proposing the use of gargles or throat sprays for preventing the infection. So I would like to state that there's a lot of evidence behind the throat spray and the mouthwash for povidone iodine at the moment. Yeah.
And how frequent should we be using a product like this if, let's just say, you have a sore throat?
Let's say in states like pandemics or when you're suffering with an active infection, you could use it for up to 3 times a day
Mm.
and for a period of up to 2 to 3 weeks safely without being affected in any way. And I can tell you that there are many other studies that are going on that are going to be using it for more than 40 days in
Mm.
being using this product to prevent themselves from getting the infection. So there are many approaches to it, but as a company representative, I would say that it can safely be used for up to 2 weeks, using it 3 times a day.
I don't know if this is a dumb question, but I'm just going to ask anyway because my teachers say there's no dumb questions. So I'm just going to ask. The question is, do you use this before a meal or after a meal, usually?
Well, it
Should you
really,
use
I mean, it's a preference. It's your preference. I mean, if you are using the gargle, it would be best that you rinse your mouth with water first, because so that this food and particulate matter is taken out and it's flushed out, so that the povidone iodine has nice smooth surface to work on. But if you have food particles, it would be rough surfaces for the product to work on. While it will do its job, it may not be as effective as when the food particles are attached. So provide a clean surface of the mouth, and it'll do its job even better.
That's okay. So then I don't think that's a dumb question. That's a actually good question. So now we know if we were to use this mouthwash, make sure, let's just say if you're doing it after food, make sure you gargle first or drink some water, clear a bit, gargle with normal water first, and then use this. Okay. Again,
I,
doctor said that you can use this 3 to 4 times a day. And
yeah.
with that said, we have another good question here from Carmen Yi. The question here it says, how if I'm not used to gargle, can I just rinse my mouth? Doctor, what do you have any comment to this?
So, okay. Well, there are many bacteria that are just in your mouth, all right? But while you're rinsing them, you could possibly take care of all the organisms that are present around your tongue and your teeth and your dentures, right? But there are organisms that are, like present a little deeper into the mouth, because of which we recommend gargling, especially the areas towards the throat where you can feel your tonsils. If you can get as far, whether by rinsing your mouth or by gargling, then you would have more protection than just by merely rinsing your mouth.
And also this product here, that you're using it on top of like brushing and flossing, because like at the back of the mouth, that's why you need to gargle, and it eliminates about 99.99%
Right.
of bacteria and germs. So this is a really good product, and this is another way to help us
Yeah.
give us another layer of protection, right?
I would like
So
to recommend. I would like to recommend that this is not to be used like a toothpaste or a toothbrush every day for at least 5 days a year. I mentioned that at all when you are in a pandemic-like situation, or you feel that you are beginning to get a sore throat, then it's best to use it then, and to use it for up to 2 to 3 weeks, 3 times a day, not for the full year.
okay, so not all year round.
Yeah,
Okay,
not,
so only when you feel certain symptoms or
yeah,
you're feeling about gonna get sick or something. Yeah. So this is
right.
another layer of protection. And with that said, we have another question. I'm loving the interaction, guys. Like I said, we get this chance to speak to Dr. M. So make sure you keep asking lots and lots of questions. Okay. So this question is from Nina. Nina Zuki Fly. Girl, you fly. Okay, so here it is. The question is, hi, I have 2 questions, please. Should I be using the mouthwash only when I have sore throat or otherwise? Will there be any effect on my teeth because of the color of the mouthwash? Because it looks like iodine yellow. That's a good question. That's a 2 question. Let's tackle the first question first. So the first
Okay.
question is basically, should I use this only when I have sore throat or otherwise?
Okay, I use betadine goggles quite regularly, and my teeth look like this. So
With that one statement, you've just
I,
answered those 2 questions.
I just wanted to give an evidence-based answer first. All right, my teeth look like that. All right. Number two. So there is very small chance of teeth getting
Discolored.
discolored.
Mm.
And especially, like if your teeth are generally normal and you don't suffer with any diseases, especially of those diseases of the enamel and the dentine, then the chances are very low. So for the general population, that shouldn't be an issue. The second question was.
The second question was basically whether there will be any effects on my teeth. So you've answered that as well. So that was sorted. Nina, thank you so much for that question. And I am loving, again, the interaction. That is really, really awesome. And do not forget, we're going to have a giveaway of all of this. So make sure you keep staying tuned, all right? We are, first, before I tell you how we're going to do the giveaway, we want to go straight into this product right here. Now, when this was sent to me, I saw it. I was a little bit nervous because, again, I've seen this before and I've never used it before. This product right here is the Colt Defense Nasal Spray from Betadine. So this is yet another layer of protection for us to kind of increase our hygiene game. So, doctor, let's just go straight into it. What makes this so amazing, and how do you use this product?
Okay, the first thing is that it's quite natural. It's an ingredient that is an extract taken out from the red seaweed that's found in the ocean. This ingredient is called as carrageenose, and it's basically some kind of a nanoparticle. So basically, it's adhesive, it's cohesive, and it forms a barrier if put into the nose. So what it does is that it works by preventing the virus from attaching into the inside walls of the nose. Since it's very important for the virus to attach itself to the inside of the wall, with which it develops the ability to multiply. Because if the virus cannot multiply, it will not cause illness. So this product prevents the attachment of the virus. And by doing so, it can reduce the time it takes to heal from cold, for example, or it could also prevent it if you use it at the right time. Just when you feel that the cold is about to come on its way, if you start using it, then you could also possibly prevent it as well. But if you, let's say, develop cold, then you could, by using it, reduce the number of days it takes to heal cold.
So this one, I'm going to talk about how you're going to win this shortly. But right now, I just really want to demonstrate this because I've never used this before. I'm always scared at the idea of poking something in my nose. So, doctor, why don't you walk me through step by step how to use this product? And I'm sure those of you watching, I'm sure you're curious as well. So, doctor?
So, Jane, just before we go into demonstrating how it works, I wanted to add 2 more points.
Oh, okay.
This product, like I mentioned, is natural. Therefore, it has no side effects. It does not absorb into the bloodstream, so it does not have any side effects. Number 2, it does not even contain any steroids, so it's absolutely natural and a very safe way of treating cold.
Perfect. So when it's natural, it's my go-to. So now is the step by step on how to use this product. First step is?
So first step is to, put your thumb at the base of the bottle so that you can get a nice grip. Yeah, correct. Okay. And then use your index finger and the third finger on the disc. Yeah. So that you can develop a movement that can, press the nozzle down. All right.
Okay. Should I do it?
Yeah. Try it in the air first. Try it in the air first.
Okay.
Yeah.
Guys, can you see that? Can you see that? It's like this. Yeah.
Yeah.
Okay.
So now,
then,
if you want to try it in your nose now.
Why not, guys? I'm sure you want to see me try it out. So I'm going to try it out right now. Okay, here we go.
It's absolutely safe. Okay.
Here we go.
Put it in your nostril.
Wish me luck.
And then take it a little deep. Yep.
That was actually quite pleasant. That was quite pleasant. So I've got 2 nostrils, so I'm imagining both, right?
Okay, how did it feel? Was it itchy? Was it anything like that?
It was very bearable. I didn't feel like there's no pain. It's just a little, a little wake me up. There's not much of a scent either. Yeah, it was actually quite pleasant.
It's good to
try
know
the other side.
The product has passed its quality test.
Yes. I'm going to try the other side real quick. Yeah, so you do get used to it, and I think you do feel a little bit of the liquid, and then when you tilt your head back, it just goes back, and then that's it. Like the sensation is as
that's exactly the way to do it.
Perfect.
Yeah.
So this one is for adults. We have here, I can see kids 1 years old and above. We're going to talk about that shortly, but
Jen,
I see
Sorry, Jen, it has to go in both nostrils.
Yeah, I did do both sides. I did
Yeah,
do both sides.
yeah.
Oh wait, that's a really good question from Zura. I literally wanted to talk about that. So let's just go straight into that. Why not? It says here, is it suitable for kids to use around 3 years old? Yes, we want to protect not just adults. We want kids to be protected as well. So doctor, can you share with us about this product right here? This the same nasal spray from Betadine, but this is for children.
It's a good question. So first answer to this is that anybody who does not react to any sprays being put into their nose, because the first reaction anybody can have is to sneeze it out. Because if you sneeze it out, then the product is thrown out of the nose, right? Most
Mm.
likely. So you want to, approach individuals who don't have allergies, who do not abruptly react to anything put into their nose. And we see that, children less than 1 year old have those tendencies because anything that you put or bring closer to their nose, they will sneeze it out. So it would most likely not
Ah.
work on them. But as children grow up and their ability to tolerate anything that goes into the nose becomes developed, that's when those are the children that you could target, or you could prescribe this product to. So I would say for I think children who are 1 to 2 years old and can would be able to accept this product better than anybody less than that age, and of course
Yes.
it's used by adults.
Yes, so actually I've got the stats right here. This Kids Nasal Spray is the winner of the Parenthood Choice Award this year for best nasal spray for kid category. So that is really really cool. So those of you watching right now, you are like figuring out, I love this product and I want to get all of them. Do not worry because right now it is time for us to announce the question that will get you the chance to walk away with a Betadine care set. So here is the question. I think it's right below, pinned right below already. What's the active ingredient in Betadine sore throat spray? Again, what's the active ingredient in Betadine sore throat spray? You're going to be walking away, 5 of you will be walking away with a set of this Betadine care set worth 150 ringgit each set. All right, all you need to do is just answer the question and do not forget to hashtag Caring Pharmacy and hashtag Betadine. And if you're like me, you kiasu, okay? You kiasu, you want to win and you want to increase your chances of winning, all you need to do is just like, share, and tag 3 of your friends together with your answer to increase your chance of winning. So that's all you have to do, guys. That's how you're going to be in the running to win one of this care set. We have 5 to be given away and just keep commenting, okay? So again, the question is, what's the active ingredient in Betadine sore throat spray? And the hashtag is Caring Pharmacy and hashtag Betadine. So we have talked about the sore throat spray. We talked about the Goggle and mouthwash. I've even shown you how to use the nasal spray. But right now that all of us we're going back to our workplaces, our schools are reopening. Doctor, I just want to ask you, what are some of the measures we can take to protect ourselves even more?
So I think most of the countries are beginning to relax their lockdowns. So what's really important is that even while a lot of relaxation has been provided, we followed the policies that have been provided by the government. Follow the guidelines and the protocols that have been provided by World Health Authorities. Of course, physical distancing is key. Wearing masks in like more dense environments where the population numbers increase, or for example, wide areas like shopping or going to restaurants or something like that. But more importantly, if you are ensuring good hand and oral hygiene, then your chances of protection, along with all other measures, would be even higher. So continue to exercise good hand and oral hygiene. And last but not the least, hope that there is a vaccine soon so that we can completely get rid of this thing one day.
But earlier you mentioned about hand hygiene. So right now, I'm sure when it comes to hand sanitizer, all of us, we are very, very, we're used to this motion, we're used to having hand sanitizers in our pockets, in our bags and stuff. And I think this, for me, I like to use this one because of that Manuka honey scent. Because hand sanitizers, if you get the ones that aren't moisturizing, it can get very like drying. Kan? I'm sure you all tried before. Kan tangan macam prunish, macam resin, macam prune kan. So that's why for me, I like to use products that are slightly more moisturizing. And this, for me, I personally really like to use this one. So I want to ask this next question, Doctor. Have the Betadine products have they been tested against COVID-19?
So COVID-19 is the name of the disease. The virus
Mm.
that causes COVID-19 is called as SARS-CoV-2. Okay, SARS coronavirus 2. And the good news is that we have tested the throat spray, the gargle and the mouthwash, the skin cleanser, and a betadine solution, which is basically used for surgical scrubbing and surgical practices a lot. So basically, the throat spray, the gargle, the
Mm-hmm.
skin cleanser, and the solution have all been tested, and they all killed the virus in as fast as 30 seconds. We did another study, and that demonstrated that the gargle can go on to kill in as early as 15 seconds. So in the first study, we demonstrated 30 seconds, but then in the other study, we demonstrated even a faster kill rate, which was up to 15 seconds. So clearly, the simple answer to that is that both studies prove that povidone iodine in concentrations from 0.45% to 10% can kill the SARS-CoV-2 virus in up to 15 seconds.
Wow, guys. So these two products, right, the sore throat spray as well as the gargle and mouthwash from Betadine, they in the product there's it contains an active ingredient. It's called the povidone iodine, is what the doctor mentioned. And this actually has been scientifically proven to have to kill the what's the name of it?
CoV-2.
SARS-CoV-2. See, we
Yeah.
learned stuff today. That's why we're here, at Caring Pharmacy, this live stream. We're here to learn, and I am not afraid of asking dumb questions. Okay, so go ahead and ask more questions. And speaking of questions, we have one here from Nur Filza. You're asking, can I use the sore throat spray alongside with other cough medication like cough syrup, etc.? Will there be interactions? That's a really, really good question, Doctor.
That's a very good question. The answer is that there is least likelihood for any interactions whatsoever.
That's a really, really good question. I personally didn't think about that. That's good. That's good, guys. So if you have any other questions, make sure you keep asking so that I can help you ask Doctor as well. Now, I have a final question here. How far away are we from a vaccine or treatment from this infection? Like, in your opinion, what's the estimation on the production of the cure? Because I think this is at the top of all our minds right now.
Okay, since I'm from the pharmaceutical industry, we follow research being conducted by other pharmaceutical companies, especially the ones that are developing the vaccine. According to one publication that provided an overview of what is the state of vaccine development right now, we see that there are about 30, 40 candidates that could be potential vaccines, but all of them happen to be in very early stages of development. However, many approaches and techniques are being deployed to expedite their development. And one hopes that the best bet would be that we would have a vaccine by mid 2021, others say by end of 2021, and others say by early 2022. I guess everybody's betting right now, but we should remain hopeful that there will be one day some treatment, some cure. But we already have an antiseptic that can kill the virus. So at least until such time we can get a vaccine, we should protect ourselves with it.
Yes, so that is it. This is what we need to do, to embrace this new norm, is to up our hygiene game, use products that can actually help us to increase our another layer of protection against the virus. So right now, I just want to say thank you so much, Dr. M, for teaching us so many different things today. I feel like I've learned a lot, and I feel like this session is too short. There's so many other questions that I do want to ask, so I hope that we'll have another session here. I'm definitely going to up my hygiene to avoid the risk of contracting the COVID-19. Now, those of you you're watching right now, just want to remind you, real shortly, we are doing this giveaway, this live stream giveaway right here. We're giving away 5 sets of this Betadine care set, each set worth 150 ringgit. All you need to do is just answer the question correctly. You can see it. What's the active ingredient in Betadine sore throat spray? Okay, you have heard the doctor, and if that is still not enough, you've not been paying attention, not to worry, just ask Mr. Google. Okay, maybe they'll give you the answer, and all you need to do is type your answer in the comment box together with the hashtag, and the hashtags are Caring Pharmacy, and hashtag Betadine. So, doctor, have you heard of the word kiasu?
Yes, I hear that all the time at home.
Yes, so kiasu means, those of you who don't know, kiasu means you don't want to lose, you want to win. Okay, so if you want to win and you want to increase your chances of winning, all you need to do is just like, share, and tag three of your friends together with your answer to increase those chances. Okay, so I love this session and I hope that we get to do more of this in the future. But right now, we're going to have to say goodbye. Thank you so much, Dr. M,
You're
for
welcome.
giving us such insightful comments and actually teaching us a lot of different things. So, those of
I,
you watching, sorry, Doctor?
I hope I have been simple enough to explain everything to everyone over here. But if I haven't been, please accept science is not a very simple thing. It's quite complicated.
Yes, it is. Not all of us are doctors, clearly. Okay, clearly. All right, so those of you, please stick around because we have a 15-second video that's going to be playing right after this, and that is going to give you another insight as to how the development. Actually, you know what? I'm not going to spoil it for you. I want you to watch it, so I'm not going to even give you a teaser. You're going to watch it yourself. With that said, my name is Jen, and this is Dr. And we are super happy to be here to be sharing with you all the different information and me to be asking all the dumb questions right here at Caring Pharmacy live stream. We'll see you next time. Goodbye.
Thanks, Jen. Bye bye.